Hello, my name is Dr. James Shamia. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. This is now the fifth week that I'm spending a few minutes with you to update you about the COVID-19 situation at the hospital. Unfortunately, as I've said over the past weeks, the situation continues to worsen and we continue to be increasingly concerned. So this shows the number of new cases week over week across all of these counties. And you see the cases continue to rise. It's also important to point out again that the amount of testing we're doing is about 55% of the amount of testing we were doing during our winter peak. And so what this means is that we feel there is likely a lot of COVID-19 that's being left undiagnosed in the community. This is the hospital census day by day across all the hospitals in all these counties. And you see, first of all, that at 675, this has significantly exceeded the prior winter peak during our last surge. Secondly, you see that the increase persists. That is a very steep line upward that is yet to show any sort of indication that it's about to level off. This is the data from our hospital. First of all, you see that we're at 168 patients in the hospital. To put this in context, during the prior surge in December and January, we peaked at 140 patients in the hospital. We've increased by 13 patients over the last 7 days and by 100 patients over the last 30 days. On the lower left, you see the vaccination status, and we've gotten questions about this, and so I want to clarify the definitions here. So it says that 85% of the patients in the hospital are not fully vaccinated. Not fully vaccinated means that you've not completed a vaccine series. So if it's a 2-dose series, you've not gotten both doses. If it was a 1-dose series, you've not gotten the 1 dose. So basically, this is a combination of a lot of people who've not gotten any vaccine and then likely some people who may have started a series and did not finish it. Fully vaccinated means you completed the series. Then in the lower right, you see the ages. And again, the ages in the ICU are lower than they've been in the prior phase of the pandemic. So we've received questions about how this surge differs in terms of mortality compared to the prior surges. And so first, you see on the graph, there are 3 sharp rises in mortality. These correlate with the 3 surges that we've had. In the upper left, you see the average age of COVID-19 deaths. And so you see in the first surge, it was 71 years old. In the second surge in the winter, it was 73 years old. And our experience to date, since August 3rd, the average age, and that's the average, has been 65 years old. And so with that being the average, you know there's some younger patients in that group. In the lower right is the average number of COVID-19 deaths we've had per day at this hospital over those 3 surges. And so you see that in the winter, in October to February, and then what's happened to us recently, it's really about the same. And that is not what we expected. Because of the skewing toward younger patients, the Delta variant wave death rate was predicted to be lower, but our experience so far is that this is not the case, in part just because of a very high patient volume. When you have more patients in the hospital, you're going to see more mortality. Unvaccinated patients make up the large majority of the COVID-19 deaths, and I should also say the large majority of patients who are in intensive care. Patients that survive are having longer hospital stays, especially in the ICU, which is exacerbating our resource and staffing issues. And while vaccinated people are generally protected from severe disease, we know they can contract and spread the disease. So from a public health standpoint, being vaccinated alone is not necessarily helping slow down the spread of COVID-19. So as I close today, I want to reiterate some points that I've made over the last few weeks, and I want to make a few new ones. So first of all, a few weeks ago, we talked about the fact that people don't really think about or worry about health care until they need health care. Then last week, we talked in more detail about the evolving strain in the healthcare delivery system. And the fact of the matter is this is worsening, and it doesn't just affect patients with COVID-19, it affects all patients. Also last week, I talked about the interconnectedness in the community during a pandemic. And so essentially what happens is individuals and organizations make specific decisions based on their priorities and values. And that's fine, but then what you ultimately see happen is those independent decisions collide in one place, and that's in the healthcare delivery system, and that's what we see happening now. I've had a variety of people tell me very kindly that they're worried about us at the hospital. And we appreciate when people say that, and we appreciate the sentiment, but quite frankly, we're worried about the community and sick people in the community. You're seeing the national conversation shift more and more to a conversation about healthcare resources. And our community is not going to be immune from having that conversation. And very specifically, what you see a lot of focus on right now is concerned about staffed ICU beds. It is a very high level of expertise to take care of critically ill patients. And so you're hearing more and more about that on the national stage. And so I want to close the way I always close, which are the steps to end the pandemic. So first of all, please strongly consider being vaccinated. We need people to be vaccinated. If you're sick, please be tested. And please, while you're waiting on a result, don't be around other people. Keep your distance. Wear a mask. And I would say, as of right now in the pandemic, I would put wearing a mask and being vaccinated on equal footing, because we know if you're vaccinated today, you're not protected for 6 weeks, but if you wear a mask today, you're protected today. Wash your hands regularly, clean frequently touched surfaces, and maximize ventilation. So again, thank you for your time, and we'll do our best to provide an update for you next week.